Okay, settle in. They won't tell you this at your regular doctor's visit. Maybe it feels awkward. Maybe they just don't think it's relevant anymore. But let me be brutally honest with you, because silence can be dangerous. If you've stopped masturbating in your later years, your body might already be sending out distress signals, quietly breaking down, and chances are, you haven't even connected the dots. No, this isn't some crude locker room joke or taboo subject we should whisper about. This is real, hard, clinical, physiological truth. And ignoring it, the consequences ripple far beyond your sex life, creeping into your brain function, your heart health, the quality of your sleep, your immune system strength, and even your fundamental sense of who you are. My name is Dr. David Lee. I've been a urologist and men's health specialist for over 30 years, working with thousands of aging patients across the country. My entire career has focused on understanding how our bodies change as the decades pass, especially concerning intimacy, hormones, and maintaining vitality. And one of the biggest, quietest threats I consistently see, too many older adults simply abandon their sexual health. They put it away like an old toy, not realizing they're locking away a vital key to their overall well-being. Here's what might surprise you. Masturbation isn't just a leftover urge from your roaring 20s. For your aging body, it's actually one of the most powerful natural tools you still possess. It's a built-in regulator for your hormones, a booster for your brain, a protector for your prostate, and even a shield against depression. And if you've stopped or perhaps never really started embracing this part of self-care, the price you're paying could be far steeper than embarrassment. It could be costing you years of healthy, vibrant living. Before we dive deep into exactly what happens inside your body when this natural rhythm stops in older age, do me a favor. If staying sharp, healthy, and independent as you get older matters to you, and I know it does, hit that subscribe button and turn on the notification bell. It means you'll never miss crucial advice tailored specifically for navigating these later years. And honestly, your feedback is gold. If what I'm about to share resonates, even a little, type 1 in the comments below. If it doesn't, type 0. Knowing where you stand helps me create content that truly supports your journey. Okay, let's pull back the curtain on the first and perhaps most overlooked consequence. What stopping does quietly to your prostate and your ability to simply pee comfortably. 1. Decreased prostate health and urinary function. The silent congestion. When I first started practicing urology over 3 decades ago, I didn't anticipate how many of my patients, often stoic men in their 60s, 70s, and beyond, would hesitantly confess something deeply private yet profoundly important. The quiet disappearance of any sexual habit, including masturbation, from their lives. I remember one gentleman vividly. He was in his early 70s, fit, mentally sharp, but utterly exhausted. "Doc," he said, leaning forward, "I'm up 4-5 times a night just to pee. And during the day, it's a constant dribble, a weak stream. Feels like I'm never fully empty. I just figured, well, that part of life was over. Didn't need it anymore." He genuinely believed that stopping was just a natural part of aging. What he didn't grasp, and what so many men miss, is that regular ejaculation, yes, even through masturbation, plays a crucial, active role in keeping the prostate functioning smoothly. Think of your prostate not as some inert lump, but as a dynamic, living organ. It produces vital fluid, it expands and contracts, and like any intricate system, it suffers when neglected. Without regular stimulation and release, that fluid inside the prostate can stagnate. Picture a pond with no outlet. It gets murky, things start to fester. That stagnation creates the perfect breeding ground for inflammation and swelling. This is called prostate congestion. That swelling puts direct pressure on the urethra, the tube running through it that carries urine. The result? You feel it as a constant, heavy bladder sensation, a frustratingly weak urine stream, dribbling after you think you're done, or that nagging feeling of never quite emptying completely. These aren't just minor annoyances. They are early warning signs flashing on your body's dashboard. And here's where it gets risky. Left unchecked, chronic prostate congestion can quietly escalate. It's a major contributor to benign prostatic hyperplasia, BPH, an enlargement of the prostate that affects nearly half of all men over 60. Studies, like those analyzing data from the health professionals follow-up study, have consistently shown a link. Men who ejaculate more frequently, around 21 times or more per month, show a significantly lower risk of developing prostate cancer compared to those with lower frequencies. It's not about guarantees, but about shifting the odds in your favor. That congestion, if ignored, can lead to more than just BPH. It can cause acute urinary retention, where you simply can't pee, a medical emergency, painful bladder infections, kidney damage from backed-up urine, and sometimes the need for catheterization or surgery. That fit man I mentioned? His congestion became so severe he needed surgery to relieve the pressure, a procedure that could very likely have been avoided with simple, consistent self-care habits earlier on. Think of regular ejaculation as flushing the system. It helps clear out old fluid, reduces inflammatory buildup, and keeps the plumbing working. This isn't about recapturing teenage fantasies or engaging in obsessive behavior. This is pure biology. It's about using your body's natural mechanisms to protect yourself in the simplest way possible. Stop this natural release in your later years, and you're not just sidelining pleasure. You're actively risking pain, chronic inflammation, and a gradual, humiliating loss of control over one of the most basic human functions: urination. I've witnessed strong, independent men become prisoners in their own homes, terrified to be too far from a bathroom. I've seen the toll of sleepless nights and constant daytime anxiety over a bladder they no longer trust, a condition often rooted in something as preventable as neglecting regular self-stimulation. The mental toll is immense. Losing that bodily autonomy chips away at your sense of independence and dignity. But the ripple effects don't stop at the bathroom door. What begins in the pelvis travels upwards, clouding your sharpest tool, your mind. 2. Cognitive fog and reduced mental clarity. When the brain misses its spark. Not too long ago, a patient in his late 60s sat across from me. He wasn't complaining about his prostate or his energy. Instead, he looked troubled. "Doc," he confessed, "I don't feel like me anymore. I walk into a room and blank on why I'm there. Mid-sentence, my train of thought just derails. I used to be sharp. Is this just old age?" It's a question echoing in my office far too often. Yes, aging naturally brings subtle cognitive shifts. But what most people, even savvy, health-conscious folks, completely miss is the powerful role sexual activity, including masturbation, plays in safeguarding brain function. It's like forgetting to oil a vital piece of machinery. Here's the neurochemical magic that happens during arousal and orgasm. Your brain releases a potent cocktail. Dopamine surges, enhancing focus, motivation, and reward pathways. Serotonin flows, stabilizing mood and promoting feelings of well-being. Oxytocin, the bonding hormone, washes over you, reducing stress and fostering calm. Crucially, cortisol, the primary stress hormone that, in chronic high doses, actually damages brain cells and shrinks memory centers, plummets. These chemicals aren't just about fleeting pleasure. They actively nourish your brain. They stimulate blood flow, delivering vital oxygen and nutrients. They strengthen neural connections, essentially exercising your cognitive muscles. They help build resilience against the mental wear and tear of aging. Now, imagine turning off this natural, internal tune-up. When you stop masturbating long-term, those protective brain chemical surges become rare events. The neural pathways that relied on that stimulation start to weaken from disuse. Over time, the edge dulls. You might notice it takes longer to recall names or find words. Concentration becomes a battle. Processing new information feels sluggish. Motivation for things you once enjoyed wanes. It doesn't happen overnight. It's a slow creep. First, forgetting names, then appointments, then struggling with tasks that used to be simple. And in that growing uncertainty, something darker often takes root. Fear. I've seen patients spiral into anxiety and even depression, convinced they're developing dementia, when often their brain is simply starved of its regular beneficial stimulation and chemical rebalancing act. For men, there's another layer: testosterone. This hormone isn't just about sex drive. It's deeply intertwined with memory, decisiveness, mental clarity, and overall vitality. Research suggests that regular sexual activity, including masturbation, can help maintain healthier testosterone levels as we age. When that activity vanishes, testosterone can decline more rapidly, further accelerating that feeling of mental fuzziness. Studies, such as those published in journals like the Journals of Gerontology, have even begun to observe links between reduced sexual activity in older adults and earlier signs of cognitive decline. I'm not saying stopping masturbation causes Alzheimer's, but I am saying this emphatically. When your brain is chronically deprived of this specific form of stimulation, emotional release, and the hormonal support it triggers, it becomes more vulnerable. It loses resilience. That fog thickens, changing how you interact, think, and ultimately, how you see yourself. One patient told me he quit his beloved chess club because he couldn't focus on the game. Another, a retired professor, described waking up feeling mentally blank. These weren't necessarily cases for heavy medication. They were often symptoms of a life disconnected from physical intimacy, even with oneself. The tragic part? This mental dimming is often preventable. Reconnecting with your own body can be a powerful way to reignite those neural sparks. If this is hitting home, if you recognize that fog or worry about your mental edge, type 1 in the comments right now. It helps me know I'm on track for you. Now, let's talk about something even more insidious. How abandoning this self-intimacy can quietly open the door to a heavy emotional numbness. 3. Heightened depression and emotional numbing. The fading light within. I once treated a patient in his early 70s, a widower, physically healthy. He didn't come in for a specific ache or pain. He sat down, looked weary, and said, "Dr. Lee, I just don't feel much anymore. Not sadness, not real joy, just flat. Blank. Is that normal now?" That question haunts me because I hear variations of it constantly. What so many dismiss as just getting old, that dullness, that disconnection from life's vibrancy. The slow fading of emotional color often has a deeper, physiological root that nobody wants to discuss. The loss of sexual stimulation, particularly self-pleasure. Here's the unvarnished truth. When you stop engaging with your own body in an intimate physical way, when you deny it that specific form of touch and release, your emotional landscape starts to shift. Quietly but profoundly. Masturbation isn't merely a physical act. It's a potent emotional pressure valve. It's your body's built-in, natural stress relief system. During arousal, and especially climax, your brain floods with powerful mood-regulating chemicals. Oxytocin fostering calm and connection, endorphins acting as natural painkillers and euphoriants, serotonin boosting overall well-being. This cocktail directly combats anxiety, tension, and low mood. Remove that regular release from your life, especially during the later years when life stressors like loneliness, grief, or health worries are often amplified, and you risk drifting into emotional numbness. That numbness isn't passive. It can be the fertile ground where depression takes root. I've watched it unfold countless times. Someone stops masturbating after a partner passes away, or because society whispers, wrongly, that it's inappropriate at their age. Weeks turn into months. They become quieter, more withdrawn. Hobbies lose their appeal. Conversations feel like effort. Sleep patterns go haywire, too much or too little. Appetite changes. The world starts to look perpetually gray. And the cruel irony? Most never connect these dots to the absence of self-touch. They blame themselves, their age, or simply resign themselves to a grayer existence. But depression in older adults often wears a mask. It doesn't always scream sadness. It whispers as fatigue, irritability, profound detachment, or a complete lack of motivation, a loss of desire in the broadest sense. While therapy and medication are vital tools, I've helped countless patients simply by gently encouraging them to reclaim this fundamental aspect of self-intimacy. One man, after months of feeling like a ghost, told me, "Starting to touch myself again. It didn't just lift the fog, document. It reminded me I was still here, still a feeling person, not just a body waiting for the end." That simple act gave him back a piece of his humanity he thought was gone forever. This is the core. Masturbation in later life isn't primarily about chasing intense pleasure or fantasy. It's about maintaining your emotional equilibrium. It's about giving your body a reliable, accessible way to feel, to release built-up tension, to reconnect with the sensation of being vibrantly alive. When you lose that connection, you're not just risking sadness. You're risking profound isolation, emotional atrophy, and sometimes the very will to fully engage with life. But the consequences don't end with mood. As the nights grow longer and sleep becomes elusive, another hidden cost emerges, one that silently undermines your entire health foundation. For poor sleep quality. Stealing your nightly repair time. I recall a man in his late 60s, exhausted. "Doc," he sighed, "I fall asleep okay, but like clockwork, 2 a.m. jolts me awake, wide awake, heart pounding sometimes. Then I just stare at the ceiling until dawn." Tests showed no apnea, no glaring issues. But when I gently inquired about his intimate life, he looked down. That part's been retired for years. What he dismissed as irrelevant was likely the very key to the deep, restorative sleep his body desperately craved. Sleep isn't passive oblivion. It's an intricate hormonal ballet essential for repair. One of nature's most effective triggers for deep, restful sleep: orgasm. During climax, your body releases its perfect relaxation cocktail. Oxytocin, promoting calm bonding. Prolactin, inducing sleepiness and satisfaction. And endorphins, easing pain and stress. Simultaneously, cortisol, the alertness and anxiety hormone, takes a nosedive. Your breathing deepens, your heart rate steadies, muscles unclench. You enter a state primed for slipping into deep, healing sleep stages, NREM and REM. Now, cut that natural sleep aid out of your life entirely, especially over months or years. Your body loses one of its most reliable pathways to deep relaxation. What rushes in to fill the void? Often it's restlessness, that frustrating 2 a.m. jolt, tossing and turning, mind racing. Many turn to sleeping pills, accepting grogginess as a side effect. Others just resign themselves to perpetual exhaustion. But the cost of chronic poor sleep is staggering. It weakens your immune system dramatically. More on that soon. It accelerates cognitive decline and memory problems. It significantly raises your risk of heart disease, stroke, and diabetes. It fuels anxiety and depression. For older adults, it directly increases the risk of falls due to daytime drowsiness and impaired coordination, threatening independence. The man who thought his retired sex life was harmless? He was unknowingly depriving his body of its natural sleep catalyst. Masturbation might seem insignificant, but for many, it's the difference between fractured, shallow sleep and 7 to 8 hours of genuine, restorative rest. One patient told me after reintroducing this self-care, "I sleep like I did decades ago. I didn't realize how much I needed that physical release to truly unwind." Too often, we mistake the consequences of neglecting our biology for inevitable old age. If you find yourself staring at the ceiling night after night, ask yourself, when did my body last experience that profound, natural release that signals it's safe to truly rest? Are you still with me? Does this resonate? Type Y below if so. It truly helps guide what I share next. Now, let's get physical again. How stopping affects the very foundation of your core strength and circulation. 5. Weaken pelvic floor and blood flow. The crumbling foundation a few years back, a retired firefighter in his 70s, once powerfully built, came to me. He wasn't leaking urine badly yet, but he had this constant, nagging discomfort in his lower back and hips when standing. "Doc," he said, puzzled, "it feels like the floor of my body, my core, it's just giving out, like the foundation's crumbling." He was describing perfectly the insidious weakening of his pelvic floor muscles, a consequence I see all too often linked to vanished intimate habits. Your pelvic floor is a complex hammock of muscles spanning the base of your pelvis. It's not glamorous, but it's absolutely essential. These muscles support your bladder, bowel, and sexual organs. They help control urination and bowel movements. They contribute to core stability, posture, and even sexual function. Most people ignore them completely until things go wrong. Leaks when you cough or laugh, stress incontinence, sudden urgent needs to pee, constipation, discomfort during sex, or even just sitting, erectile dysfunction, or that lower back/hip pain. Here's the crucial, often ignored connection. Regular sexual stimulation, including masturbation, is a major workout for these vital muscles. During arousal and orgasm, the pelvic floor contracts rhythmically and powerfully. This isn't about vanity. It's about essential maintenance. These contractions pump nutrient-rich blood into the pelvic region, keeping tissues healthy and elastic. They strengthen the muscles, much like doing Kegels, which are beneficial too, but this is nature's version. They keep the nerves firing and the communication lines between muscles and brain active. It's about preserving function. Stop this natural exercise and those muscles don't just rest. They weaken and atrophy. Blood flow slows to a trickle. Tissues become less supple. Nerve signals fade. The result? You might start experiencing that frustrating urge incontinence. Gotta go now. Slight dribbling after urination. Difficulty fully emptying your bowels. Pain during movement or sex, or a noticeable drop in sexual sensation or function. For men, erectile quality often suffers. For women, vaginal dryness and discomfort can worsen. The impact is deeply practical. I've seen confident people start avoiding social events, fearing a leak. Others become embarrassed by sudden accidents, not realizing the root cause might be years of neglecting this internal muscle group. Poor pelvic floor strength directly contributes to falls, a major threat to independence in older age. You might find yourself relying on pads or planning outings solely around bathroom access. The longer this goes on, the harder it is to rebuild. The emotional toll of this loss of bodily control and dignity is immense. Reclaiming safe, regular self-stimulation is one of the most natural ways to reactivate these muscles. Flood the area with healing blood flow, and remind your body that this foundation still matters and can be strong. But the benefits of that blood flow extend far beyond the pelvis, reaching into your very defenses against illness. 6. Lowered immune function. Disarming your body's defenses one winter. A longtime patient in his late 60s, usually robust, came in looking worn down. "Doc, I've been sick 3 times since fall. Colds linger for weeks now. I used to shake them off in days." We checked diet, sleep, meds, nothing obvious. Then, carefully, I asked about sexual activity, including solo. He smiled awkwardly. "Nah, that ship sailed a while back." He didn't realize that the ship he'd let sail was carrying vital reinforcements for his immune system. The connection isn't metaphorical. It's biochemical fact. Sexual arousal and orgasm trigger a surge of beneficial substances beyond just the feel-good hormones. Crucially, levels of immunoglobulin A, IgA, a key antibody found in saliva, tears, and mucous membranes, spike significantly after orgasm. IgA is your body's first line of defense against invading pathogens, especially those attacking your respiratory and digestive systems. Think colds, flu, stomach bugs. Endorphins released also help reduce systemic inflammation, a major driver of many chronic diseases and a suppressor of immune response. Now, deprive your body of this regular, natural immune boost for months or years, especially during a life stage when your immune system, thymus function, T-cell production, is naturally declining. You're essentially disarming one of your body's easiest, most accessible defense mechanisms. It's like removing the batteries from your security system. You might not notice immediately, but when a threat comes, a virus, bacteria, your body struggles to mount its usual robust response. I see it clinically. Patients who've shut down this aspect of self-care often report getting sick more often, taking longer to recover, or experiencing more frequent flare-ups of chronic inflammatory conditions, like arthritis. They rarely connect it to the absence of sexual release. The implications are broad. A well-functioning immune system isn't just about fighting colds. It's crucial for long-term disease surveillance, including cancer, cardiovascular health, wound healing, and overall resilience. Regular sexual release helps maintain healthier hormonal balance, reduces damaging stress hormones like cortisol, and improves circulation. all factors that support optimal immunity. When this release disappears, a domino effect often starts. Stress increases, sleep suffers, further weakening immunity, inflammation rises, and overall resilience plummets. One woman in her 70s, widowed and celibate for years, decided to reclaim this self-care after our talk. Months later, she reported, "I can't explain it scientifically, Dr. Lee, but I feel stronger, like my body is finally fighting with me again, not against me. It's not magic. It's biology responding to the signal that life, and the will to defend it, is still thriving." 7. Loss of body ownership and self-worth. The vanishing sense of self, perhaps the most profound consequence, is the hardest to measure, but I see its shadow constantly. A retired school principal, once commanding and articulate, sat hunched in my office. "Dr. Lee," he said softly, "I don't live in this body anymore. I just inhabit it, like a tenant in a rundown building." That sense of profound disconnection, of feeling alien in your own skin, is tragically common among older adults who've abandoned physical self-intimacy. When you stop touching your body in a caring, attentive, feeling way, when you dismiss masturbation as irrelevant or inappropriate, you initiate a quiet process of detachment. Self-touch isn't just about seeking pleasure. It's a fundamental act of presence. It's your nervous system's way of saying, "I am here. This body is mine. It matters." It reinforces the connection between your mind and your physical self. Without it, a psychological and emotional distance grows. It becomes easier to ignore minor aches, to avoid looking in the mirror, to neglect grooming or dressing with care. It fosters the belief that this stage of life isn't worthy of nurturing, that your body is merely a vessel waiting to be discarded. This disconnection is the fertile ground for a deep erosion of self-worth. I've witnessed it lead to profound emotional numbness, shame about the aging body, withdrawal from all physical affection, even hugs, and a loss of motivation for basic self-care like exercise or healthy eating. "Why bother?" becomes the silent mantra. One woman told me tearfully, "I stopped touching myself after menopause. I just stopped feeling like a woman. And the less I touched myself, the more I felt like I disappeared." That word, disappeared, cuts to the heart of it. When you neglect this intimate connection, you don't just lose pleasure. You risk losing your sense of identity, visibility, and inherent value. You become a ghost in your own life. Reclaiming your body through self-touch isn't about replicating the intensity of youth. It's about radical self-acceptance. It's about honoring the life that still pulses within you. It's about saying, "I am still here. I still feel. I still deserve to be seen, known, and cared for, especially by myself." Reconnecting, even gently and privately, begins to reverse that erasure. It reminds you that aging isn't vanishing, that your worth isn't tied to youth or external validation, and that you can truly come home to yourself again. That reclamation is perhaps the deepest healing of all. Final thoughts. Reclaiming intimacy, reclaiming health. It's not too late looking back on 30 years of listening, treating, and guiding. The most heartbreaking losses aren't always the dramatic diagnoses. They're the quiet ones. The spark fading from someone's eyes, the resignation to a smaller, grayer life, the slow surrender of bodily autonomy and joy, often mistakenly blamed solely on getting older. If you've stayed with me this far, I suspect you feel that too. Because the moment we abandon our sexual selves, the moment we decide that part of our body and spirit is no longer deserving of attention, a chain reaction of quiet consequences begins. We've walked through them. How the prostate suffers without regular release, inviting urinary misery. How the brain, starved of stimulation and neurochemical surges, grows foggy. How emotional numbness can deepen into depression without that natural stress relief valve. How deep, healing sleep becomes elusive. How the pelvic floor weakens and circulation suffers. How your immune defenses are subtly disarmed. And how, perhaps most painfully, your very sense of self can begin to vanish when you disconnect from feeling your own body. These aren't small prices. They're steep tolls on your health, independence, and joy. But here's the powerful truth resonating through every story I've shared. It doesn't have to be this way. Reclaiming this aspect of self-care isn't about recapturing youth or engaging in something shameful. It's about honoring your biology. It's a declaration. I am still alive in this body, and I am responsible for its well-being. Masturbation in later life, approached with self-compassion, is preventative medicine. It's circulation therapy, cognitive exercise, hormonal regulation, emotional grounding, immune support, and a profound act of self-reclamation rolled into one. It's not a frivolous indulgence. It's a core component of holistic health for the aging body and mind. Start where you are. Start gently with curiosity and kindness, not pressure. Listen to your body. If this message rings true for you, please don't keep it to yourself. Like this video, share it with someone you care about who might need to hear this, a friend, a partner, maybe even silently acknowledging it for yourself. Drop a comment below, type 1 if this resonated, share your thoughts, or ask questions. Your voice and experiences help build a community where we can talk honestly about aging well. And if you haven't yet, subscribe and hit that bell. There's so much more vital information coming, tailored to help you live your healthiest, most vibrant life at every age. Your body, your mind, and your spirit are still worthy of care, connection, and joy. Start reclaiming yours today.